Hi, welcome all. Here we are discussing about the topic nanotechnology and its applications in the field of healthcare. A nanoparticle or ultrafine particle is usually defined as a particle of matter that is between 1 and 100 nanometers in diameter. The term is sometimes used for larger particles up to 500 nanometers or fibers and tubes that are less than 100 nanometer in only two directions. Nanoparticles are spherical, polymeric particles composed of natural or artificial polymers. Nanotechnology refers to the branch of science and engineering devoted to designing, producing, and using structures, devices, and systems by manipulating atoms and molecules at nanoscale, that is, having one or more dimensions of the order of 100 nanometers. Below are some examples of recent advances in this area. Cancer detection and treatment. Gold nanoparticles as probes for the detection of targeted sequences of nucleic acids, and they are also being clinically investigated as potential treatments for cancer and other diseases. Drug delivery. Nanotechnology researchers are working on a number of different therapeutics where a nanoparticle can encapsulate or otherwise help to deliver medication directly to cancer cells and minimize the risk of damage to healthy tissue. This has the potential to change the way doctors treat cancer and dramatically reduce the toxic effects of chemotherapy. Imaging and diagnostic tools. Tools enabled by nanotechnology are paving the way for earlier diagnosis, more individualized treatment options, and better therapeutic success rates. Diagnosis and treatment. Nanotechnology is being studied for both the diagnosis and treatment of atherosclerosis or the buildup of plaque in arteries. In one technique, researchers created a nanoparticle that mimics the body's good cholesterol, known as HDL, which helped to shrink plaque. Vaccine development. Nanomedicine researchers are looking at ways that nanotechnology can improve vaccines, including vaccine delivery without the use of needles. Researchers also are working to create a universal vaccine scaffold for the annual flu vaccine that would cover more strains and require fewer resources to develop each year. Genetics. The design and engineering of advanced solid state nanopore materials could allow for the development of novel gene sequencing technologies that enable single molecule detection at low cost and high speed with minimal sample preparation and instrumentation. Smart pills. The term smart pills refers to nano level electronic devices that are shaped and designed like pharmaceutical pills but perform more advanced functions such as sensing, imaging, and drug delivery. Nanotechnology has previously helped in developing various kinds of smart pills such as the pill cam, a capsule with a miniature video camera, and dose tracking pills. Nanobots. Nanobots are microscale robots which essentially serve as miniature surgeons. They can be inserted into the body to repair and replace intracellular structures. They can also replicate themselves to correct a deficiency in genetics or even eradicate diseases by replacing DNA molecules. This property is still under development. Nanofibers. Nanofibers are being used in wound dressings and surgical textiles as well as in implants, tissue engineering, and artificial organ components. Scientists are working on developing smart bandages which, when left on the site, will absorb itself into the tissue once the wound heals. Embedded nanofibers in these smart bandages can contain clotting agents, antibiotics, and even sensors to detect signs of infection. COVID 19. For image based and clinical diagnostic of COVID 19, nanomaterials are emerging as promising substrates because of their unique optical, electronic, magnetic, and mechanical properties. Nanomaterials that have been proposed for viral detection include metal, silica, and polymeric nanoparticles, quantum dots, and carbon nanotubes. That's all. Thank you.